Wonderful. Thank you so much, Dr. Gilbert, for that introduction. It is a pleasure to be presenting today on our most recent research study titled Physical Activity Among Latina People with Parkinson Disease and Their Care Partners. This is a truly collaborative effort working with two professors in the Department of Kinesiology, Dr. Luis Columna and Dr. Kristen Pickett. So I want to give a big thank you to all collaborators who are helping with this grant, as well as the APDA for supporting. So with that, let's get started. First things first, I want to disclose the funding that I have received to support my salary as a postdoctoral fellow, as well as the funding we have received to implement this research study. Finally, I want to mention that I own no stocks or equity in any pharmaceutical company. Next, I'm going to define some terms that I will be using throughout the presentation today. First, I will be using the word PA or physical activity throughout the presentation to indicate any type of movement, including work, recreation, exercise, and sporting activities. Second, I will be using the word care partners to define any individual who is a family member and or friend who provide informal, unpaid care to the person with PD. And the term Latino, Latinas to describe individuals who identify as being a part of a Latin American or Spanish cultural origin living in the United States. This term is regardless of race and or English or Spanish proficiency. So with that, I am now going to talk about some background and our motivation to do this work. So I got working with the PD community as a dance educator and master's student, co-teaching a dance class with Hani Schwartzleiner for people with PD and their care partners. The picture on the slide depicts one of my favorite days, Scarf Day, where we would explore different movement possibilities using scarves. The class was a blast, and we would use different choreographies to opera, rock and roll, really whatever the participants wanted. We also conducted a research study for people with PD who attended these type of community-based classes with their care partners. And we found that people with PD were motivated to go to the class because it helped them manage their symptoms and also keep moving, while care partners felt it was a type of informal social support group. And the literature on PA for people with Parkinson disease and their care partners confirmed these overall positive outcomes from PA participation. However, when it comes to who was coming to the class, as well as the PA literature, we see a lack of representation of Latinos with PD and their care partners, similar to what we have seen from other presenters today. And this may be due to a lack of recruitment, but also perhaps not reporting the race and ethnicity of participants. So now I want to talk a little bit more about our background. So from the introduction from Dr. Gilbert, as well as other presenters, we know that Latinos with PD are less likely to be referred to clinical services. But then what happens when it comes to physical activity opportunities outside of these more formal services? Physical activity that is related to recreation, exercise, and/or sports. Are Latino Latinas with Parkinson disease participating in dance programs like the one depicted in this image of a person with Parkinson disease and a dance instructor in New York? Do they have access to these types of physical activity opportunities? If they don't, what type of physical activity are they participating in, if any? And then all of these questions led us to our long-term research goal and purpose of our study. So our long-term research goal is to develop a physical activity intervention that involves and improves the health of Latino Latinas with Parkinson disease and their care partners, so that they too can have equitable access to meaningful physical activity interventions that can help manage their symptoms and improve their quality of life. With guidance from Dr. Columna, as well as Dr. Pickett, we are using our knowledge about implementing interventions for underrepresented groups, specifically the Latino community. So moving on to the purpose of our study, we are looking at the individual and community-based factors that impact the physical activity engagement of Latino Latinas with Parkinson disease and their care partners. And when I say individual factors, this means anything from symptom management, care experiences, and personal preferences. And when I'm looking at community-based factors, this means anything from accessibility, availability of structured or programmed opportunities, as well as unstructured or home-based individually motivated physical activities. In order to achieve our purpose, we are using a framework to guide our study. We are using the REAIM framework to guide this study, and this framework is within the dissemination and implementation science research. It is a strategy to help close the gap that we see between translating research findings to community change. The REAIM framework has 5 constructs: reach, effectiveness, adoption, implementation, and maintenance. This framework is guiding our interview guides as well as our study design. So for example, when looking at reach, we're asking questions just about how are they hearing about these physical opportunities and how are they choosing to participate. For effectiveness, we are asking participants what they want to get out of their participation in physical activity and what is meaningful for them. For adoption, we are asking about how senior centers, community centers, and other organizations can help their success in physical activity. And then for implementation, we're asking participants who they would like to teach or lead the physical activities, whether that is the care partners or other individuals. And then finally, for maintenance, we are asking participants how we can imagine long-term programming and access to physical activity opportunities. With this framework in mind, we will now talk briefly about our study design. First, we will recruit 20 Latina individuals with Parkinson disease and 20 Latino care partners who care for those individuals with PD. It is important that both the individual with PD and care partner identify as Latino so that we can understand what barriers and facilitators exist to participation in PA for both participant groups. Once we recruit these individuals, they will go through a screening to determine that they can speak either English or Spanish, that they are adults, and that they have no evidence of dementia so that they can comprehend and respond to our interview questions. Finally, for our data collection, we will be looking at demographics of participants, conducting interviews either in person, over the phone, or Zoom based on participant preferences, and take memos to reflect on the analysis. Now I will briefly discuss where we are in the process. Currently, we are working to center the voices of Latino, Latinas, and those who work with the community and PD community. This is especially crucial considering that in the states we hope to recruit, such as Wisconsin, that the majority of the population is white. Therefore, it is key that we are networking and connecting with communities who are trusted by the Latino community. Therefore, we have been consulting with the Wisconsin Network for Research Support to design community advisory group, which will meet 1 to 2 times to consult on the recruitment materials and interview questions. The community advisory group will consist of Latino individuals with PD and those who may just have movement concerns. What is important for us here is that participants in the group and consulting calls can provide feedback on the questions and recruitment materials. On the next slide, we're going to take a look at the flyers that we have in progress. These 2 flyers depict the community advisory group meeting that we will have with the community members, which will take place on the 15th of November. And in this, we will have a Zoom meeting where we're going to provide the recruitment materials and interview questions and really talk with participants about what they think about these materials in order to reach our target population. Now, currently, we are looking to conduct these community advisory groups and consulting calls, apply the feedback to the study materials, and recruit the Latino, Latinas with PD and their care partners in the Midwest area. With that, I would like to say gracias, thank you to the Department of Family Medicine and Community Health and the Department of Kinesiology for their support as we continue doing this research study.